Hi, my name's Maxine Clark and I'm one of the directors of the National Training Academy. This safeguarding soundbite is about the Trilogy of Risk. You may know the Trilogy of Risk as the toxic trio. That's what it used to be called. It's now referred to as the Trilogy of Risk. This is the co-occurrence of parental domestic abuse, parental substance misuse, and parental mental illness in a child's life. To some, the presence of this trio signals that a child may be experiencing abuse or neglect. However, toxic stigmatizes the family by labeling their situation and may be seen as something poisonous or unpleasant. It dehumanizes vulnerable families and it may prevent them from getting the help that they need. With this in mind, we now use the term trilogy of risk. This trilogy describes the three issues that I mentioned before. And the reason why these issues often coexist is that a parent misusing drugs or alcohol is more likely to be in a relationship where domestic abuse occurs, and those who misuse drugs or alcohol have a greater chance of experiencing mental ill health. Conversely, adults with mental health problems are more likely to abuse drugs or alcohol, so there are many different situations that could lead to the trilogy of risk being present in a family. It's more important to note that experiencing one of these issues may not result in the trio developing. Nor does it mean that a parent who is experiencing one or more issues is abusing or neglecting their child. However, the main point here is the combination of all three risk factors can significantly increase the risk of abuse or neglect of children or young people. Ensuring relevant professionals are aware of the trilogy of risk and are able to identify it can help protect children and young people from significant harm. If you are working with a family where this trilogy of risk is present, there are things that you can do. You can speak to your designated safeguarding lead or manager for help and advice. You can work with the family and don't do things to them. This is known as early intervention. Understanding that risk is dynamic and fluid, and you may see an escalation in volatile circumstances, is also something you can do and plan for. You can share relevant and proportionate information with the right people at the right time. Be professionally curious and don't take things at face value. And where applicable, always complete a whole family assessment. For more information around safeguarding or any of the things that we've talked about today, you can visit our website at www.tnta.co.uk.